How long does a glaucoma test take? Visiting the eye doctor to check for glaucoma can feel overwhelming, not least because there isn't a single glaucoma test, but a whole battery of exams. Depending on whether you're just getting a routine screening, a full diagnostic workup, or follow up for known glaucoma, your doctor will pick some or all of the following tests. Understanding what each test involves and how long it actually takes can remove the mystery. It can help you schedule the right amount of time, arrange a ride home if your eyes will be dilated, and plan breaks so you stay comfortable instead of stressed. In short, knowing the timing for each step means you won't be rushed or confused during what may be one of the most important appointments of your year. Below, we break down each common glaucoma-related test, roughly how long it takes, and why it matters. We then explain how these pieces add up to real-world exam lengths, from a quick pressure check to a full 2-hour glaucoma workup. Finally, we offer practical tips for your visit and set realistic expectations by visit type, stage of disease, and purpose of the exam. Remember, taking these tests seriously and sparing time for them is vital for catching any glaucoma damage early and protecting your vision. Why there is no single glaucoma test. First, let's be clear. Glaucoma isn't diagnosed by one magic test or machine. Instead, ophthalmologists and optometrists put together information from several exams. For example, one person's glaucoma checkup might include only an eye pressure test and a quick look at the optic nerve during a routine eye exam. But a patient with suspected glaucoma or confirmed disease will get many more tests, like a full visual field test, imaging scans, nerve photos, etc. Each test gives a different piece of the puzzle. Some measure intraocular pressure, IOP, others measure corneal thickness, the drainage angle of the eye, the thickness of optic nerve fibers, or functional vision in the peripheral field. No single test alone can diagnose most cases of glaucoma. In fact, experts agree that combining multiple tests is essential for accurate screening and diagnosis. Knowing this helps you understand why an appointment might feel long. Your eye doctor needs a full picture of eye health before concluding whether glaucoma is present or progressing. Below are the most common components of a glaucoma evaluation, listed roughly in the order they might happen. Technicians often screen before you see the doctor. We note the approximate time each step takes, so you can see how minutes add up and why a thorough exam can stretch to an hour or more. Eye pressure measurement. Tonometry, 1 to 3 seconds per eye. Tonometry measures the pressure inside your eyes, an important factor in glaucoma. There are two common methods. Goldmann applanation tonometry, GAT, uses a tiny blue light and a small probe touching the surface of the eye. You'll get an anesthetic drop, and then the doctor or technician will align a slit-lamp microscope to gently touch a calibrated tip to your cornea. The actual pressure reading in each eye takes only about 1 to 2 seconds once set up, though positioning the instrument can take a minute or two per eye. Non-contact air puff tonometry uses a quick puff of air. You sit at a machine and look at a target light while it blows a short burst of air into your eye. Each pressure measurement is over in a fraction of a second and feels like a quick tap on the eye. Either way, once the test starts, the result is instantaneous, usually just a couple of blinks. In practice, counting the time to place you at the machine and prepare, drops, focus, plus the blink of measurement, budget about 10 to 20 seconds per eye total. Tonometry is fast, taking only a second or two per eye after alignment, but it's a vital first step. You'll hear your pressure result almost immediately after each reading. Corneal thickness, pachymetry, 0.5 to 1 minute per eye. Pachymetry checks the corneal thickness, the clear window of the front of your eye. This matters because corneal thickness affects pressure readings and glaucoma risk. To do this, the doctor uses an ultrasonic probe pointed at your cornea. After numbing drops, the probe contacts your eye. It takes a series of quick measurements in each eye, typically repeated a few times for accuracy. Each test on one eye only lasts about 30 seconds to a minute, because the handheld pachymeter probe takes several readings very quickly. The technician will tap or lightly touch your eye repeatedly. Most patients barely notice, and a stable average is calculated. So allow about 1 to 2 minutes total for pachymetry, both eyes. Although fast, this confirms whether your pressure readings need adjustment for thin or thick corneas. Drainage angle inspection. Gonioscopy, 2 to 5 minutes total. Gonioscopy examines the eye's drainage angle, where fluid exits the eye, a key part of glaucoma assessment. During gonioscopy, the doctor places a special mirrored contact lens on your anesthetized eye and looks through a slit-lamp microscope. By rotating the lens, your doctor can see all 4 quadrants of the angle. This test requires patient cooperation to keep the eye steady under the lens for a brief time. But the total exam usually lasts around 5 minutes or less. You'll have an anesthetic drop so you don't feel the lens pressing on your eye. The doctor will move the lens slightly to inspect different sections. Gonioscopy itself is quick. A couple minutes per eye is typical, but it feels longer because you are focused at the slit lamp. Plan about 3 to 5 minutes total per eye. As the Cleveland Clinic notes, a gonioscopy exam should take 5 minutes or less, although the actual appointment may run longer if more tests follow. Optic nerve exam with slit lamp, 3 to 5 minutes. Next, your eye doctor will examine the optic nerve head, the back of eye nerve tissue, through the slit lamp, usually with a handheld high-powered lens. This lets them see the cup, a small depression in the nerve, and the surrounding nerve fiber layer. Your pupils may or may not be dilated yet, but the doctor will look for any thinning of the nerve rim or other abnormalities. Each eye takes a couple of minutes to inspect carefully. The doctor will ask you to look in different directions and use the lens to examine all parts of the optic disc, including patient positioning and focusing. Budget about 3 to 5 minutes per eye for this direct examination. No blinking required, but keep your eye still as best you can. This careful inspection is quick but extremely important as it evaluates the core of glaucoma damage. Optical coherence tomography, OCT scans, 5 to 15 minutes total. Optical coherence tomography, OCT, is a non-invasive imaging scan that maps the optic nerve and retina in detail. For glaucoma, the machine is typically set to scan the optic nerve and the nerve fiber layer around it. Each scan only takes a few seconds per eye once your eye is in position. However, older patients or those with trouble fixating may need multiple attempts and adjustments. In real-world timing, plan for 5 to 15 minutes total for OCT scanning. This includes seating you at the machine, focusing your eye on a target light, and repeating scans if necessary. Very dry eyes, cataracts, or minor movement can cause scans to blur, so the technician may do 2 to 3 tries per eye. Each successful scan is almost instant, but positioning and quality checking accounts for the bulk of the time. For example, scans might be around 5 seconds each, but setting up and ensuring good images, especially if you blink or move, adds up. Elderly patients or those with tremors often need several extra seconds or a retry per scan. Ultimately, OCT is usually about 5 to 10 minutes of real-time work, though busy clinics sometimes book up to 15 minutes for this step. Optic disc photography, 3 to 5 minutes. Many glaucoma specialists also take optic disc photographs for detailed records. This uses a stereo fundus camera to capture color images of each optic nerve. The camera typically sits on a chin rest like other retinal cameras. You look at a fixation target, and the camera flashes a quick, bright light to snap a picture of your retina and nerve. Each eye's shoot usually takes just a few moments, but including alignment, focus, and retries for clear images, budget 3 to 5 minutes total. The technician may take one color photo of each nerve or even a stereo pair, 2 slightly offset images for a 3D effect. These images help the doctor compare nerve appearance over time. The process is painless and very quick, often less than 10 seconds of flash per eye, but aligning the camera and reviewing the shots takes a bit longer, hence a few minutes total. Visual field testing, 20 to 30 minutes. Visual field testing is the component most patients find time-consuming. It measures your peripheral side vision and detects any blind spots caused by glaucoma. During the test, you rest your chin and forehead on a machine and look at a central light. You'll press a button whenever you see small lights appear in your periphery. The 2 most common strategies are Humphrey 24-2 CETA Fast and CETA Standard. The fast protocol typically takes about 5 to 8 minutes per eye, while the more thorough standard test takes about 7 to 12 minutes per eye. Your doctor will test one eye at a time, often giving a short break between eyes. Including instructions and moving between eyes, most patients spend 20 to 30 minutes total on standard visual field testing, both eyes. The Cleveland Clinic notes that each visual field usually isn't longer than about 5 to 10 minutes per eye. In practice, technicians may schedule 10 to 12 minutes per eye and then offer rest to avoid fatigue. Accuracy of the results can drop if you're tired or anxious, so competent clinics encourage a break after the first eye. Even so, visual fields often dominate the visit time. It's simple but tricky. Each eye takes on average 5 to 10 minutes of testing focus. Tip: if you have a hard time concentrating, ask if you can start with the visual field so you're fresh. Also, blinking or looking away can ruin a printout, requiring a repeat. It's worth pausing and reopening your eyes when allowed, rather than risk a break in fixation. Putting it all together. Typical appointment durations. Every clinic visit is different, but by adding up these components, you can estimate the total time. Here are some common scenarios. Basic screening. Optometrist routine exam. If you just need a glaucoma screening as part of a regular eye check, the basics might include eye pressure, tonometry, maybe pachymetry, and a quick optic nerve look. This could take as little as 10 to 20 minutes of the exam, often wrapped into a broader 30 to 60-minute exam for glasses or other checks. No dilation usually means faster time. Initial diagnostic workup, eye specialist. If you're seeing a glaucoma specialist for the first time with suspect signs or as a second opinion, expect a full battery of tests. This will include everything listed above, plus dilation and weights. Typically, this comprehensive appointment lasts 90 to 120 minutes, 1.5 to 2 hours. Much of that is dead time, waiting 20 to 30 minutes for dilation drops to work, plus the patient history and sittings. One clinic notes that a thorough eye examination can take up to 2 hours, depending on tests. Indeed, many doctors recommend you plan at least 2 hours for a full dilated glaucoma workup, which may include disc photos and multiple imaging tests. Routine follow-up, stable glaucoma. If you have established glaucoma and it's stable, follow-ups focus on monitoring. These visits usually include pressure checks, an OCT scan, and visual fields at most appointments. Expect about 45 to 75 minutes total. For example, pressure and OCT might take 10 to 15 minutes, and a single visual field per visit, another 10 to 15 minutes. Even without dilation, the visual field now and then still means around an hour in the clinic. Techs and nurses may repeat an OCT or check your charts, but the patient time is under an hour for most healthy follow-ups. Intensive progression check. If there's concern your glaucoma is worsening, your doctor may add extra tests. This could mean dilation, stereophotographs, a repeat gonioscopy, or an additional 10 to 2 visual field around the central vision. Such visits can stretch to 90 minutes or more. New or progressing glaucoma justifies reviewing every angle again. For example, if fields were borderline or images hard to interpret, repeats and comparisons could add 15 to 30 minutes. It's rare for a routine checkup to exceed an hour or two, but in special diagnostic situations, slide rule says to set aside extra time. The role of pupil dilation. Many glaucoma exams involve dilating your pupils with drops like tropicamide or phenylephrine. Patients often dread how dilation extends the visit. In reality, the drops themselves take just seconds to apply, but the effects last. After getting the drops, it takes about 20 to 30 minutes for pupils to fully widen to maximum dilation. Once your pupils are fully dilated, the effects on your vision can last 4 to 6 hours for most people. You'll notice bright light sensitivity and blurry near vision during that time. This means 2 things for planning. First, you will wait quite a while in the office after the doctor puts drops in, typically 20 to 30 minutes, sometimes a bit longer if your eyes are slow to dilate. Many clinics shuffle you between tests during that waiting period, like having OCT or photos done right after the final dilation effect is waited out. Second, you shouldn't drive yourself home if your pupils are dilated. Light-colored eyes tend to dilate more and recover slower. Plan for a ride or have sunglasses and a responsible escort ready. Most people can drive with dilation if they feel they can handle bright sun behind dark glasses, but it's often uncomfortable, especially during the first several hours. Some modern practices now use wide-field imaging cameras that can get a good view of the optic nerve without dilation. These devices can save time by avoiding dilation entirely, allowing eye exams to proceed without the 30-minute wait. However, most glaucoma specialists still prefer a fully dilated exam for the most reliable results. It lets them see the extreme periphery of the retina and nerve. Advanced glaucoma tests. In addition to the above routine tests, your doctor may occasionally order specialized exams that take longer. Anterior segment OCT, 5 to 10 minutes. This is like the normal OCT scanner, but aimed at the front of the eye. It images the drainage angle and cross-section. It's faster and more precise than gonioscopy lenses in some cases. The patient just sits at the machine again for a few minutes as it scans your eye from the side. Plan about 5 to 10 minutes if this test is done. Ultrasound biomicroscopy, 15 to 20 minutes. This is a very detailed ultrasound of the very front of the eye. A special probe with a tiny water-filled cup touches the numbed eye. It can take pictures of angle structures hidden behind the iris. The patient lies back, and a technician gently places the probe. It is more time-consuming, about 15 to 20 minutes, because each quadrant of the angle is scanned, then the device is repositioned. It's only used if extreme detail is needed, for example, to evaluate very narrow angles or a lens fragment in the angle. Diurnal tension curve, half day to full day. Glaucoma pressures can fluctuate through the day. If your doctor suspects your single clinic measurements may miss a peak, they might measure your IOP multiple times, for example, every few hours. This means coming in the morning and getting checked again at set intervals, sometimes including evening measurements. This could stretch over an entire morning or full day in the clinic or hospital. It's uncommon, but sometimes done for challenging cases. Basically, it warms up a lot of time. You'll spend most of the morning in the eye clinic getting 3 to 4 measurements. Provocative testing, 30 to 60 minutes. For certain rare suspected angle closure cases, a doctor might do a dark room or prone position test. The patient is in a completely darkened room or lying down for up to an hour, often 30 minutes, to see if the eye pressure spikes or the angle closes on its own. This is only for specific diagnoses and is done under controlled conditions because significant pressure changes can be induced. If ordered, set aside at least 30-60 minutes. Home monitoring. Emerging technologies are shifting some testing to the patient's routine. For example, the iCare Home is a small rebound tonometer that patients can use themselves to record pressures at different times of day. And there are new tablet or VR-based visual field apps for home use. These can reduce clinic time by collecting extra data outside your appointments. A self-tonometry reading only takes a minute or two at home, and a quick visual field app might take 2 to 5 minutes. But these approaches are still supplementing rather than replacing in-office tests. If your doctor uses these, they will still verify in clinic, but you might spend less time in future visits as more checks shift to your own schedule. Practical tips to make your visits smoother. Arrive early. At initial visits especially, you'll have paperwork and possibly preliminary tests, like vision and eye pressure checks by technicians, even before seeing the doctor. Arriving 15 to 20 minutes early can prevent other delays. Test order. If you know you fatigue easily, ask politely to do the visual field test first. Most clinics do fields after poking the eyes, but you can request to start with fields while you're fresh, before dropping anesthesia or dilation. Dress comfortably. Wear loose clothes and shoes. You'll sit in different machines and chairs. Since dilation makes you light sensitive, bring a hat or brimmed cap in addition to sunglasses. Bring sunglasses and a driver. If dilation is planned, definitely bring sunglasses and arrange transportation. The hour after dilation will be bright and blurry, not safe for driving for everyone. Eating and rest. Have a light snack beforehand. You may be at the office for quite a while without leaving to get food. Also, if you need a restroom break or feel tired during a long test, let your technician doctor know. Better to take a brief pause than compromise a test, especially fields. Communicate. During the visual field, these tests can feel repetitive. If you need a quick rest or the tester is rushing you between eyes, speak up. Technicians want you to do well. They can pause between eyes or take a fast break if you ask. Saying something like, "I'm a bit uncomfortable, may I rest my eyes for 1 minute?" is perfectly reasonable. Scheduling. Morning appointments are often best. Eye pressures can creep up later in the day and you'll be more alert for tests. If you notice your meds work best overnight, an early morning IOP check will capture the trough. Also, clinics often run on time better in the morning. Repeated attempts. It's frustrating if the OCT or field fails and you have to do it again. Remember, the technician isn't trying to prolong your visit. They are striving for accurate, high-quality data. For example, an OCT scan that's too twitchy might yield a false defect. It's better to rescan than gamble on bad data. Be patient. It ultimately protects your care. Conclusion: setting realistic expectations. In summary, think of your glaucoma workup as an investment in your vision. A simple pressure check or screening can take only a few minutes, but a full dilated glaucoma exam can easily fill 90 to 120 minutes. Plan accordingly. First, glaucoma evaluation. Expect a thorough exam. This often means 90 minutes to 2 hours at the eye clinic, including dilation time. Your provider will likely do all baseline tests: pressure, pachymetry, optic nerve photos, OCT scans, fields, and possibly gonioscopy. It's a lot, but it gives the doctor a baseline against which all future visits are compared. Routine monitoring visits. If glaucoma is mild and stable, follow-ups are shorter, maybe around 45 to 60 minutes. The doctor will still check your pressure, look at your nerve via OCT or exam, and usually repeat a visual field at least once a year. Many patients alternate fields and OCT each visit, making each visit about an hour. After the exam, the data is reviewed with you, which adds a few minutes more. Quarterly or advanced follow-ups. If your glaucoma is moderate or advanced, your doctor may see you every 3 to 4 months. These visits might also hover around an hour each, but will include fields or other tests more frequently. For example, in a year you might have 3 office visits of 60 minutes, 1 with a field, 2 without. Test frequency and stage. In general, as glaucoma becomes more serious, both the frequency and thoroughness of testing increase. Early-stage glaucoma might get fields yearly, while advanced glaucoma patients do fields every visit. Consequently, advanced disease means longer annual testing time. Remember the big picture. Spending an hour or 2 at the eye clinic may feel like a hassle, but the information gathered is invaluable. Each pressure reading, nerve scan, and field result helps your doctor spot any subtle progression before you notice any vision loss. This early detection is key to preserving vision for decades. In fact, investing these hours of testing now can protect years of sight ahead. A thorough 2-hour glaucoma workup may seem burdensome, but it lays the groundwork to keep your eyesight safe. Arguably, it can be the most important and valuable couple of hours you spend in any medical office this year, because the results can literally keep your vision intact. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.